So I'm gonna knock. I'm gonna introduce myself.
Okay.
My name's Jamie. I am a nursing student. I'm going to perform an older adult assessment today. Can you tell me your name and date of birth?
Cynthia Schmid, 12/21/1950.
I verified her name and date of birth with her wristband. I'm going to ask if she has any allergies.
Okay, minocycline.
Okay, and what's the reaction?
Rash.
I would first visually assess her. Her skin is warm, pink, dry. She has no lacerations. So then I'm gonna sanitize my hands. Then I am going to start my assessment. Is it okay if I touch you?
Yes, yes.
Okay. So I'm gonna look at her head. I'm gonna feel on her scalp to make sure that there's no bumps, lumps, or make sure that there's no abrasions. She has no dandruff. She has no lesions. Her head is symmetrical. I'm gonna have you smile for me. Her smile is symmetrical. There's no deficits on either side of the face, so that it shows like signs of stroke. I'm gonna have you puff your cheeks. Yeah. Symmetrical on both sides. I'm going to take her blood pressure.
Get my sleeve out of here.
Yes, please.
Got a tough one.
Yes. Is it okay if I take your blood pressure on this arm?
Yeah.
You haven't had like a mastectomy or anything like
Nope,
that?
nope, no. That's one they always do it in. For some reason, I always left side.
It's your lucky arm?
Yep, evidently.
What is your blood pressure typically at?
I think in the 120s over 80 or less.
Okay.
Okay.
Start. So I got 120 over like 88.
Oh, that's nice for me.
Well, you're having temperature.
Yeah.
Then you're good.
Yeah, that's typically that's high for me.
I'm just gonna have you leave that.
Yeah, because you got to do the.
Yeah, I gotta listen to you.
Yeah, the doctor goes it through all this stuff. I didn't have this much on though.
Yeah. So I am going to feel your radial pulse. heart rate of 80.
Oh,
30.
Yep.
I didn't have a watch.
yeah.
I was just guessing.
Oh.
Yeah. So then I'm gonna do a cardiac assessment and listen to your heart.
Okay.
I'm just gonna have you relax and just gonna listen to your apical pulse. And I'm just going to heart sounds in the S1, S2, S3, and S4 are all equal, non-bounding, normal, regular. Yep, regular. So that's good. And then I'm going to your lungs. I'm going to listen to your lungs in the front, back, and on both sides. Okay?
Like too close here.
You're good, right there. So every time I touch, I'm just gonna have you take a deep breath.
Okay. Okay.
Take deep breath again. These sounds are clear bilaterally. You're no wheezing, no rubbing. So then I'm going to inspect her skin. We're gonna look at skin turgor on her hands. So we're gonna pinch.
Do you need to drink more?
Does go back to shape. It does take a few seconds. There is a little bit of tenting, but nothing. And then I would feel both radial pulses. I already felt the left side, so I'm going to feel the right side. Here. And I feel your incubital. Now we're going to assess the extremities. I'm going to put your arms up like this. I'm going to have you push against me, pull against me. Perfect. Same with your toes. I'm going to have you push, and then I'm going to have you pull. Push. I'm going to have you pull. And then I'm going to have you push. On my leg. Push your legs up.
Oh.
Yep. And then I'm going to have you pull. There we go. I'm going to have you close your eyes. I'm going to do a series of tests. You're going to tell me what you're feeling. I'm going to tell you what you need to look up. Okay?
Mm-hmm.
So I'm going to put your hands on your legs. And I'm going to have you, there you go. And put your fingers out. I'm going to have you tell me if I'm moving your finger up or down. Okay?
Down, up, up, down, down, up, down.
And I'm going to have you keep your eyes closed, put your hands flat on.
Okay.
I'm going to have you put your hands back and forth like this as fast as you can with your eyes closed. Okay?
Okay, ready?
Go ahead.
Good enough?
Yes. And then I am going to do the 2-point distinction test. And have you, just kind of put your wrist down. And I have you tell me if you feel 2 points.
Oh.
And then you're going to say 2, 2, 2, 2, 2 until you feel 1.
Oh.
Okay? I'm going to start up here. Ready?
Mm-hmm.
You close your eyes.
Oh.
Yep.
I feel 1.
You only feel 1?
Really? Oh, 2. 2.
All right, we're going to do it again. Ready?
Yeah. 2. 2. 2. 2. 1.
Perfect. That was the right answer.
Oh my gosh.
We're going to do the other side.
Never had such a thing.
I know, I'm sorry. It's weird. Ready?
2. 2. 2. 2. 2. 2. 2. 2. 2. That is the weirdest. That's hard to.
It's strange, isn't it?
Yeah.
Okay. So then I'm going to, I would also take like a cotton ball and have your eyes closed and see if you could feel like the light touch of a cotton ball on your cheek. I do not have a cotton ball on here. So I would have you close your eyes and tell me what side you feel it on, if it's light. I would also do we'll do sharpened dull. So go ahead and close your eyes again. So I'm just going to use a paper clip and you're going to feel sharp side or dull side. Okay?
Mm-hmm. Sharp. No.
Then I would do the other side.
That is weird too.
I would also check for vibration. So have you have your eyes closed.
Oh yeah, I feel it. Yeah. Yep. Yep. Yeah.
So you feel the vibration. Then we do the tendon.
It don't matter.
Okay. So we are going to do the triceps and the biceps.
Okay.
And then I will also check the DTR. So I'm going to have you do your
Okay, good. Yeah. Yeah, I felt them all. It's just that they.
super reactive.
No.
My knee is crazy.
My knees are much more reactive than this.
About that one.
Oh, you did?
It
Did
did.
something happen?
Yeah, it
Oh.
went up a little bit.
Oh.
All right, I'm going to have you slide back.
Yeah. Sit up higher.
That's okay. In this case, I'll just have you cross one leg over.
Okay. That made me jump.
All right, we'll do the other one. So then we would also check. Okay. For the purpose of the video, we're not going to take her shoes off, but we would take the back of the doll side up the foot, and you're looking for the toes to curl. They curl out. And that's an abnormal finding. If they curl in, that's normal. Baby's toes kind of curl out.
Oh.
Yeah. So we do that to both sides. We would also check reflex back here. Then I'm going to have you do a couple series of tests for a stand-up. You're doing these with your eyes closed.
Okay.
Don't fall. I'm going to move the chair, so don't
Okay.
fall down either.
Okay.
So this one, you're just going to put your hands to your side, and you're going to stand there. This is the Romberg test. We're looking for her to be swaying. She's not. You can stand on one foot.
Okay. Okay. That might not be a good idea.
Okay. So that's
okay. Well, that's weird though. Why did I do that?
all right. Try the other foot. It is weird, huh? It's very unsteady.
Without looking at her. Is
Yeah.
that why?
I think it's abnormal, but I think it could also be like an age thing too.
I can do it with my eyes open.
Yeah.
Let's go.
I don't know. You feel off balance.
Yeah, I do. Really
I think it's because you can't visually see, though. And then this one, You're gonna walk on your heels. You can do it with your eyes open.
Where do you want me to go?
Then you walk on your
Tippy toes?
Yep. Then you walk on your tiptoes. Okay. And
That's
then
easy. Well, you're probably not going
Okay.
to.
Can you do like a squat?
Like how far down?
It's like a deep knee bend.
Oh,
so
I
as
don't
far
know how
as
far
as far
I
as
can
you
go.
can go.
Probably that's
Okay,
probably good.
that's good.
To
Yep.
be safe.
Yep. I don't want you to fall. And then I'm gonna do heel to toe. You're just gonna walk heel to toe with your hands to your side. So now we're gonna move on to ears, nose, and throat.
Okay.
I would first assess her ears by talking to her. I've been talking to her this whole time. She has not had any difficulty hearing me. So I'd say that these next tests should be fairly easy. So we're going to do the Weber test, which is a tuning fork.
Okay.
I'm going to place it on your head, and you're going to tell me if you feel it.
Oh.
And then I'm also going to do it on the back of your head, so that's the Renin test. And then I'm going to have you tell me when you stop hearing it here, and then I'm going to put it here, and you're going to tell me when you stop hearing it. And that should be double. So like if you hear it for 10 seconds, you should hear it for 20 seconds. After you stop hearing it back here.
Wow.
Okay?
Okay.
Very fun.
Never had this stuff done.
All right, so we're going to go ahead and start. You feel it? You feel it?
Done. Yeah.
Okay. Then we're going to do her right ear first. Okay, so it was 5 seconds on the back, then 10 seconds on the front. You're right there.
Almost done.
We'll say 5 and 10 for both. And then I am going to do a whisper test. So I'm going to stand behind you and whisper. And you have to say the word, okay?
Okay.
All right. You can say it loud if you want.
Cheeseburger. Apple.
Then I would do a finger rub test. Tell me if you hear anything and what side you hear on.
I think something over here.
Okay? So then I would.
In your pocket.
Oh, yes. This.
I saw you put it there.
All right, so I'm just going to inspect your nose. We're going to look at the symmetry of her nose. Her nose is symmetrical. She has no like polyps inside of her nose or anything that would cause any issues with breathing. I would palpate the nose. Do you have any pain or tenderness?
No.
And then I would also, if I had oils, I would have you plug one side of your nose and close your eyes and tell me if you smell a specific scent.
Oh.
Yeah. And then I would do the other side. Make sure that your sense of smell is there.
Okay.
And then I would your mouth.
Okay.
So I'm gonna have you, stick out your tongue and say ah. Okay, I don't see any like swollen tonsils. There's no abscesses. There's no TBI or anything back there. So anything like that.
Right.
Which is good.
Yeah.
And I would also palpate the neck, the shoulders. And I'm gonna have you push up. They're equally strong. um, Also, when she opened her mouth, I would like document any like filling, anything that she had, or she had dentures or anything like that, or dental devices. So for the neck, like I said, we would inspect. I would palpate for any lumps, anything with the thyroid. You don't have any thyroid issues, do you?
No.
You do. Then I'm gonna have you push your head against my hand. On the other side. Perfect. And then you look up, look down, look left, right.
Whoops, I did it backwards, but
Either
yeah.
way. Range of motion is good. I'm gonna look at like the symmetry of her neck. Everything looks symmetrical. I would palpate her. Now we're gonna assess the extremities. I'm gonna put your arms up like this. I'm gonna have you push against me, pull against me. Perfect. Same with your toes. I'm gonna have you push, and then I'm gonna have you pull. Push. I'm gonna have you pull. And then I'm gonna have you push. On my leg, push your legs up. Yep. And then I'm gonna have you pull. There we go. I'm going to have you close your eyes. I'm gonna do a series of tests. You're gonna tell me what you're feeling. I'm gonna tell you what you need to look up. Okay?
Mm-hmm.
So I'm gonna put your hands on your legs, and I'm going to have you there you go. And put your fingers out. I'm gonna have you tell me if I'm moving your finger up or down. Okay?
Down, up, up, down, down, up, down.
And I'm gonna have you keep your eyes closed, put your hands flat on.
Okay.
I'm gonna have you put your hands back and forth like this as fast as you can with your eyes closed. Okay?
Okay, ready?
Go ahead. Perfect.
Good enough?
Yes. And then I am going to do the 2-point distinction test. And have you, just kind of put your wrist down. And I have you tell me if you feel 2 points.
Oh.
And then you're going to say 2, 2, 2, 2, 2 until you feel 1.
Oh.
Okay? I'm going to start up here. Ready?
Mm-hmm.
You close your eyes.
Oh.
Yep.
one.
You only feel one?
Really? Oh, two. Two.
Alright, we're gonna do it again. Ready?
Yeah. Two. 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 One.
Perfect. That was the right answer.
Oh my gosh.
We're gonna do the other side.
Never had such a thing.
I know, I'm sorry. It's weird. Ready?
Mm-hmm. Two. 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 That is the weirdest. That's hard to.
It's strange, isn't it?
Yeah.
Okay. So then I'm going to, I would also take like a cotton ball and have your eyes closed and see if you could feel like the light touch of a cotton ball on your cheek. I do not have a cotton ball on here right now. So I would have you close your eyes and tell me what side you feel it on, if it's light. I would also do we'll do sharp and dull. So go ahead and close your eyes again. So I'm just going to use a paper clip and you're going to feel a sharp side or a dull side. Okay?
Mm-hmm. Sharp. Dull.
Then I would do the other side.
That is weird too.
I would also check for vibration. So you have your eyes closed.
Oh yeah. I feel it, yeah. Yep. Yep. Yeah.
For vibration. Then we do this tendon.
It don't matter.
Okay. So we are going to do the triceps and the biceps.
Okay.
And then I will also check the DTR. So I'm going to have you do your
Okay, good. Yeah. Yeah, I felt them all. It's just that they.
super reactive.
No.
My knee is crazy.
My knees are much more reactive than this.
Not that one.
Oh, you did?
It
Did
did.
something happen?
Yeah, it went up a little bit.
Oh.
All right, I'm going to have you slide back.
Yeah. Sit up higher.
That's okay. In this case, I'll just have you cross one leg over.
Okay. That made me jump.
All right, we'll do the other one. So then we would also check. Okay. For the purpose of the video, we're not going to take her shoes off, But we would take the back of the doll side up the foot, and you're looking for the toes to curl. They curl out. And that's an abnormal finding. If they curl in, that's normal. Baby's toes kind of curl out.
Oh.
Yeah. So we do that to both sides. We would also check reflex back here. Then I'm going to have you do a couple series of tests for a stand-up. You're going to do these with your eyes closed.
Okay.
Don't fall. I'm going to move the chair, so don't
Okay.
fall down either.
Okay.
So this one, you're just going to put your hands to your side, and you're going to stand there. This is the Romberg test. We're looking for her to be swaying. She's not. You can stand on one foot.
Okay. Okay. That might not be a good idea.
Okay. So that's
Okay. Well, that's weird though. Why did I do that?
all right. Try the other foot. It is weird, huh? It's very unsteady.
Without looking at her. Is
Yeah.
that why?
I think it's abnormal, but I think it could also be like an age thing too.
I can do it with my eyes open.
Yeah.
Let's go.
I don't know. You feel off balance.
Yeah, I do.
I think
Really
it's
good.
because you can't visually see though. And then this one, you're gonna walk on your heels. You can do it with your eyes open.
Where do you want me to go?
Then you walk on your
Tippy toes?
Yep, then you walk on your tiptoes. Okay. And
That's
then
easy. Well, you're probably not going
Okay.
to.
Can you do like a squat?
Like how far down?
It's like a deep knee bend.
Oh,
So
I
as
don't
far
know how far
as far
I
as
can
you
go.
can go.
Probably that's
Okay,
probably good.
that's good.
To
Yep.
be safe.
Yep. I don't want you to fall. And then I'm gonna do heel to toe. You're just gonna walk heel to toe. So now I'm going to ask the patient what her height and weight is. Typically in a hospital setting, we would do like a standing scale or a bed scale. And then we would either ask the patient their height or measure them. Measure.
So my height is 5'8".
Okay.
My weight is about 165.
All right. I'm going to count your respiration. So say about 16 respirers. And then I'm going to, are these your real nails?
Yeah, they're my real nails with
With
gel polish.
Okay, I'm just gonna have you put your nails together like this. We're looking for the shamrock shape.
Oh.
She has it. That's good. There's no clubbing.
Oh.
So clubbing can typically be a sign of like poor circulation and stuff like that. You don't have it, so that's good.
That's good.
Yeah. So no clubbing. My patient does have nail polish on. Typically, I would check the capillary refill, and you would want it to be 1 to 2 seconds. I can't really tell with her nail polish, so that's okay. I would also check her SpO2 with a pulse ox. For the sake of this, we'll say she's at 99% on the mirror. She's not having any difficulty breathing or anything like that. I would check her. Can you open your jaw for me? And then close. We're looking at the transmandibular joint, or the TMJ.
Okay.
We're looking for any kind of popping or like pain with that. Did you have any pain when I did that?
No.
Okay. So that would be the sign of like, it could be a sign of joint stuff. Yeah, like arthritis or. And then I'm going to auscultate her carotid arteries for any signs of bruise. I'm just going to have you hold still. Or any of that. I'm going to palpate your face. Do you have any like tenderness?
No.
So we're checking for her sinus. Any tenderness back here? Here?
No.
Here? No. Also, while doing that, I would have her swallow. I can feel her swallow. Her thyroid seems fine, symmetrical. There is no goiter or anything like that. Then I would do an eye assessment. So I'm going to check for PERLA, which is pupils, reactive, equal to light, and then accommodate. I'm going to shine this light in your eyes. You're just going to look straight at me. You're just going to see if your pupils react to the light, okay? They are equally reactive.
Good.
And then I'm going to have you follow my pen. And her eyes do accommodate. They both go in at the same time. And then I'm going to have you cover one eye. And then I'm going to drop your hand. Both of them are equally there so that it doesn't drift. There's no drifting. I am also going to check. I'm going to do a confrontation test. So I'm going to have you cover one of your eyes. And I'm going to cover the same eye with my hand. And you're going to tell me when you see my fingers, okay? This is for peripheral vision.
I see your fingers,
okay.
But it's like
right there. Sorry.
Yeah.
It works better
Yeah.
on the same side.
Yeah. Okay, I see your fingers. I see your fingers.
Okay. Then we're going to switch and do the other side.
Fingers, but are you putting up two fingers or
yes.
what are you? Okay.
I'm wiggling them.
Okay, yeah, I see your fingers.
All right.
That's just different.
Yeah, it's a fun one. And then I would have her do the Snellen chart, which is the axiom chart.
Oh.
Yep, so I'm going to have you stand up.
Okay.
My Snellen chart is over here. And typically, I'm just going to have you stand right there. It would be done at 20 feet.
Oh.
Yeah. So,
yeah.
Okay. So I'm going to have you cover one eye, and then read the lowest on the chart.
Okay. FD FLTCE. Oh, I can probably read some on the bottom, but
so that was 2013. So she's reading 20 feet. And then you're going to cover the other eye. And then do the same
Okay, FD, FPLTCEO. I can read some on the bottom too.
And then we're gonna have you read with both eyes. I'm just gonna document.
Okay, FEZOL FTP D. Is it a D? It's a D.
So you read the bottom line?
Bottom line.
Okay, so that's gonna be 2010. Down. And then I am going to have you read the Jaeger chart. So there's front and back. And you're gonna read the smallest one that you can read, holding it at arm's length.
Oh, okay.
Okay?
Oh, boy. Oh,
You can flip it over. It's bigger font on the back.
oh, I can read that.
Yeah.
Sand miles to the south of the tropic, but the heat of the climate soon repelled the invaders and protected them.
So that was 1.75 meters that she read. And then I'm going to inspect your eyelashes and your eyebrows.
I hardly have any eyelashes.
You've got eyelashes.
Very little.
She has eyelashes. Her eyebrows are full. I'm gonna have you kind of like pull your eyes down for me. Her conjunctiva is pink. She has no drainage or anything like that. Then I would also do a red light test with the oh, what is the eye test? But I would check her red light reflex if I had it, and it would show up red move through the white. I would also look at the color of the sclera, which is the white part of the eye. It looks fine. They're white. Then I would look at her cornea. Good. And I would also look at the iris, which is the color part of your eye.
Okay.
Normal. You don't have any like weird growths or anything. And then I would also look at but first I'm going to take your blood pressure.
And down, huh?
Yes.
I didn't know it was different.
Sometimes we do like orthostatic.
I didn't realize when you cross your legs too, it makes your blood pressure higher. The doctor, my blood pressure is a little bit higher than they think. She'll look down, my ankles are crossed.
Stop.
Yeah.
Stop doing
And then she'll do it again.
Yeah.
Then it's more normal.
So I've already asked the patient what the normal blood pressure is.
Better, I hope.
122/78.
Okay, that's much better. Quit cutting my tree down, so or
Yeah.
not my tree.
You're not as anxious now. And then I would auscultate. So I'm going to listen to your vowel sounds. You're just going to lay there. And then right upper quadrant. Left upper. Lower. I'd say that she has active vowel sounds in all four quadrants.
Okay.
Good. And then I would palpate the tenderness. No. Okay. I won't palpate too hard. So everything's good there. I'm gonna check the lower extremity strength. So I'm gonna have you push up against me, push down. Okay, other side, push up, push down, and have you bend your knee up. All right, move the other one. Perfect. Then I would have the patient roll over and do the same test on the legs. So they would push up and push down. You don't have to.
Okay, good.
I'm going to have you push with your feet, pull with your feet. Any pain or discomfort?
No.
Any pain or discomfort in the knee when you were bending it?
No.
So then the knee bend is to check like the range of motion in the hip. Did you have any pain in your hip when you did that?
No.
Okay. And then I would do a
Okay.
We are not doing that.
Right.
But I will verbalize how I would do it.
Mhm.
I would have the patient in the gown, and I would open the gown, and we would start, let's say, the left breast. I would look at the symmetry of both breasts. I would document any abnormal finds, lesions, any like masses that I could visibly see. I would document nipple shape, color, whether it's
Inverted.
or not. Thank you. And then I would palpate the breast. I would do a circular motion, and I would document any abnormal findings based off of a clock. So if I found a mass on the breast, like up to the chest, I would say that's 12 o'clock, and then I would document the size, and I would compare it like either golf ball size, marble size, grape size, whatever I thought was closest to the size of it, whether it was palpable, soft, movable, whether there was pain associated with it, warmth. I would also auscultate up into, or not auscultate, palpate up into the clavicle for any masses because there's lymph nodes there. And I would also do the axillary to make sure that there's no masses in the lymph nodes there. I would do that on both sides and then document any abnormal findings. And then I'm done. And that's just going to have to be good enough. My book work. Yeah. I don't even know if I can read that. Okay. So for the older adult assessment,
compared to somebody who's in their 20s to 30s or late 20s to 30s. I feel like my patient, Cynthia, who is 73 years old, has a lot of similarities because she is fairly healthy for her age in comparison to probably most 73-year-olds. For example, her blood pressure was like 128 over like 88, I think. And then when she was lying down, it was like 120 over 80, which is very good. Her heart rate's fairly slow, between 60 and 80, which is average. Neurologically, she is a little slower than what I think myself as a 30-year-old is. But she's still fairly like fast. She was able to identify the 2-point distinction test fairly easy. The only thing that was a little different with neuro was that she was a little off balance when she was standing on one foot. And when she stood on one foot and closed her eyes. And when she closed her eyes and we did the Romberg test, she did sway a little. But I don't feel like that's a super abnormal finding for somebody at 73 who has back issues. She does have some arthritis in her knee, in her specifically left knee. But fairly overall, health-wise, she seems to be able to communicate well. She has no assistive devices. She lives on her own. She's independent. She has no assistance. She drives. She has had cataract surgery. So she can see better than prior. So that might be a little different. Pretty much she's very independent for a 73-year-old. Fairly healthy. Doesn't take any medications, vitamins. Chest-wise, she has no barrel chesting. She had no wheezing. She has no COPD. She has no history of smoking. She rarely drinks. So for somebody her age who has always taken care of her body, I think she shows it. I feel like sometimes she is probably healthier than some 30-year-olds. So that kind of concludes my adult assessment. I hope you enjoyed all the awkwardness. Thank you. Bye.